Hi everyone, my name is Obaid Siddiqi, and today I'm going to be talking to you about an epidemic that is taking over the United States. Our nation's epidemic of opioid and overdose is one of the most significant health challenges we face. In 2016, American life expectancy dropped for the second year in a row, in large part because of rising numbers of drug overdoses. Anyone who takes opioids is at risk of developing addiction. Your personal history and the length of time you use opioids play a role, but it's impossible to predict who's vulnerable to eventual dependency on abuse of these drugs. Legal or illegal, stolen, and shared, these drugs are responsible for the majority of overdose deaths in the United States today. So, how do people get addicted to these drugs? How do people get addicted to opioids? When you take an opioid repeatedly over time, your body slows its production of endorphins. The same dose of opioids stops triggering such strong flood of good feelings. This is called tolerance. One reason opioid addiction is so common is that people who develop tolerance may feel driven to increase their doses so that they can keep feeling good about the drugs, um, or keep feeling that good feeling in their body. Some ways people abuse these drugs is opioids are most addictive when taking them using methods different from what they're prescribed, such as crushing a pill so that it can be snorted or injected. This life threatening practice is even more dangerous uh, if the pill is long or extended acting or has those types of formulas inside that pill. Rapidly delivering all the medicine to your body can cause an accidental overdose. Taking more than what your prescribed dose of opioid medication or more often than prescribed also increases the risk of addiction and overdose. The length of time you use prescribed opioids also plays a role. Researchers have found that taking opioid medication for more than a few days increases your risk of long term use. When increasing your risk of addiction, the odds you'll still be on opioids a year after starting a short course increases after only 5 days of opioid drug use. Simply put, America has prescribed and still prescribes a stunning amount of potentially addictive pain medications. Um, from 1999 to 2015, according to the CDC, the amount of opioids prescribed in America tripled. Uh, and the problem of pain in America is a very real one. The prescribing numbers in 2015 were actually a slight decrease from the peak in 2013, but even in 2015, the number is four times what is prescribed per capita in Europe. The 2015 level was the equivalent of 640 milligrams of morphine for every man, woman, and child in America. So, like, enough to keep someone medicated around the clock for 3 weeks with Vicodin or morphine every few hours. So, how did we get to such immense supply of these drugs? So we have to take it way back. Part of the story is a revolution in how physicians were taught to treat pain. Where they were once worried about the addictive potential of opioids, the conventional wisdom over the past several decades became that the risk of abuse was very low, and that physicians should get used to the idea of regularly prescribing opioids for all kinds of pain. Compensation and quality rating systems assessed how happy patients were with the pain treatment, adding pressure on doctors to overprescribe out of the concern that their scores would be dinged. This shift also undermined plenty of good work that was being done to treat pain in a holistic approach, through physical therapy, nutrition, and other methods. In 1998, one assessment found that there were more than 1,000 multidisciplinary pain clinics across the country. But by 2005, there was only 85. Insurers also stopped insurers stopped paying for these more holistic approaches to pain treatment, and when they realized how cheap an option pills could be instead. And then the pills kept getting cheaper as generic versions made it onto the market. Of course, as we all know today, these supposedly cheap pills can impose a tremendous cost on someone's life. Earlier this year, the National Institutes. There's ongoing research that's happening to prevent opioid addiction. Earlier this year, the National Institute of Health launched its HEAL initiative, a more than $1 billion effort that will study not just how to treat addiction, but also how to better treat pain. NIH's work will involve going to very roots of the pain itself, studying patients who have acute pain associated with surgical procedure and patients who have suffered acute trauma. This will help create a comprehensive data set that can help us predict which patients may develop long-lasting chronic pain. NIH is also exploring the possibilities for new non-addictive pain treatments. For instance, researchers are working to engineer cell-based screening platforms, which can closely approximate the physiology of a human pain and addiction to identify leads for testing new drug candidates in humans. So in conclusion, opioids are safest when used for 3 or few more days to manage acute pain, such as pain that follows surgery or a bone fracture. If you need opioids for acute pain, work with your doctor. Take the lowest dose possible for the shortest amount of time, act exactly as it's prescribed. If you're living with a chronic pain, opioids are not likely to be the safe and effective long-term treatment option. Many other treatments are available, including less addictive pain medications and non-pharmaceutically therapies. Aim for a treatment plan that makes it possible to enjoy your life without opioids if it's possible. Help prevent addiction in your family and community by safeguarding opioid medications while you use them and disposing any unused opioid drugs properly. Contact your local law enforcement agencies, your trash and recycling service, or even the Drug Enforcement Administration, the DEA, for information about local medication take-back programs. If there's no take-back programs available in your area, consult your local pharmacist. I'm sure they'll be more than happy to help you discard those drugs. So what's the most important step you can take to prevent opioid addiction? Recognize that no one is safe. We all play a role in tackling the grip these drugs currently hold on our loved ones and our communities. Thank you so much for your time and listening to my speech.